And we begin here at 6 with the very latest numbers on the coronavirus pandemic and a grim forecast. Today is one of the deadliest days so far in Missouri, with 19 more deaths. The total is now 133. In Kansas, they added 7 more deaths. The total there is 69. Now, look at these numbers right here from the University of Washington. Scientists are predicting how many deaths the entire country could have by August 4th. And it's predicting that Missouri will have more deaths, over 1,700, than some of these states like California, even Washington, also Illinois, which is obviously a bigger state than Missouri. But think about that. Missouri is predicted to have more deaths than the entire state of California, where these outbreaks started. Brad.
And Ellen, experts agree that one key to stopping the spread of the coronavirus is widespread testing. But tonight, there are questions about one kind of testing that's taking place.
That doesn't help you, and it may give you the sense of security that you're made of steel and you can leap tall buildings. But the reality is that you're not going to do much leaping if you have COVID-19. And the antibodies.
That's Dr. Steve Stites, the chief medical officer at the University of Kansas Health System. And he's talking about testing for antibodies to see if someone has had the coronavirus. KCTV5's Greg Payne explains what doctors say you need to know before you get one of the tests.
Here at Blue Lotus Family Medicine in Lee's Summit, it is absolutely calm right now, but yesterday it was a whole different story.
I think yesterday was really the first day that this parking lot and these medical offices have been this busy.
Loads of cars lined the parking area yesterday at Blue Lotus Family Medicine in Lee's Summit for drive-through antibody testing.
In theory, this test will be able to tell you whether or not you are currently infectious or whether you have had the COVID-19 virus recently.
But Dr. Tiffany Blythe says the test has many limitations, including a 12% false negative potential.
That is usually when people are using it outside of the recommended time window, which is about 7 to 10 days after exposure or infection and up to 8, maybe up to 12 weeks after exposure.
And it can also provide false positives as well. Out of the 80 tests done yesterday, Dr. Blythe says about 6 to 7% tested positive. But along with many medical officials, Dr. Blythe encourages people to remain cautious no matter the result.
This test will not tell you if it is okay to go and go back to your regular life, as people are calling it.
They encourage people to still wear masks in public, wear gloves if possible, and wash hands frequently.
There is a 14% reinfection rate, we think. So even if you have had it, that doesn't mean you can't get it again.
Blue Lotus Family Medicine will offer drive-through testing Friday from 9 a.m. to 4 p.m. and will continue offering it Monday and Friday for the next several weeks. All of their services are $50 or less, and each test takes roughly 10 minutes. Reporting in Lee's Summit, I'm Greg Payne for KCTV5 News.
And after the test, all results are sent to the county health department. And if you do test positive, the county health department takes over. There'll be additional questions and, of course, additional testing.